trauma-informed, a term representing the atmosphere within which more trauma-specific treatment can take place. So one of the principles of trauma-informed treatment is to have an atmosphere that is safe, that is not only physically safe, but that the client perceives as safe and kind of emotionally experiences as safe. So within that context, then more specific trauma treatment can take place. I spoke about some of the neurobiological changes of, when a person becomes traumatized. Everything changes hormonally in your nervous system, in the brain, to pay attention to potential trauma and potential danger. And what helps to reverse these neurobiological effects? A sense of subjective emotional safety is what helps to reverse these effects. And so for treatment to take place, first, one has to establish a sense of emotional safety for the client. And with children, it's quite easy to see whether they feel emotionally safe or not. Adult clients, one can ask them and they can often tell you, but with children, if the therapist is responding in an appropriate way, the child will tend to move a little closer to the therapist or move their body a little, more towards the therapist. If the therapist is off track, the child will tend to move away from the therapist or, move slightly away or just turn away. And so these kind of nonverbal cues, along with other things that the therapist knows to keep an eye on, can let the therapist know whether they're on track or not, and can give a clue as to whether the responses are appropriate for a particular child or not. Working with children who have experienced trauma requires an enormous amount of knowledge. So I've already talked about learning to understand how children communicate through play. Treatment method that's most appropriate is being one of the many types of play therapy. And into the play therapy can add other treatment methods such as EMDR, eye movement desensitization and reprocessing, bit of behavior therapy, and that's something often parents can follow up with at home, some sensory therapies. Some other therapies can become part of play therapy, sometimes art therapy or sanitary therapy. But usually these are add-ons to basic play therapy with young children. I think it's critically important that we nip these behaviors in the bud before they become problematic. I have worked with adults who did not receive therapy as children and, where they have continued to act out sexually. No child wants to grow up to become a sex offender, and most of these children, even without treatment, won't. It's prudent for parents and caregivers to educate themselves, to find therapists that they feel confident with, and to ask many, many questions, and to expect their questions to be answered. Thank you very much, and have a good day.